Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, we are welcoming back Dr. Edward Smink, the author of The Soul of Caregiving, a caregiver's guide to healing and transformation, for part 2 of our mini-series. Welcome, Dr. Smink.
Thank you. It's great to be with you and to share some of the thoughts I have learned by being a caregiver.
Yes. And we know you are also the author of the book, The Soul of Caregiving, a caregiver's guide to healing and transformation. And for part 2, for our listeners and viewers, we're going to be talking about the importance of being heard and sharing your story. Part 1, we discovered and learned about the importance of identifying compassion fatigue as well as caregiver burnout and some of the things people can do to help prevent those things from happening. So, Dr. Ed, why is it important for caregivers to be heard and to be able to share their story?
Again, caregivers in general don't share their story. And what happens is it just keeps bottling up. They have something to say. They have an experience to be shared. And if you allow yourself to speak openly about your experience, what happens is it helps in the healing process, especially if you're heard. So the important thing is, can you find someone that will listen to you? And again, the question is, what does it mean to listen? Most of us, when we talk to someone or we pretend we're listening, really aren't listening. What we're doing is, in our mind, we're trying to think of what's the next thing I want to say. And so the idea is that we have sort of filters, and because we have those filters, we don't allow ourselves to listen. I like what the U.S. State Department suggests when they treat diplomats. They say to listen, one must use both ears. They say to listen, you want to watch and maintain eye contact. I worked with an administrator. Every time I went in for a meeting, he would always be doing something. He wasn't attentive to me being there. And what happens is you have a sense that, am I worth being there if that person isn't going to listen? And that means that you have a sense of undivided attention, that you're really focused on trying to be present. And I'll talk about hospitality, to create the space to listen. And the other aspect is to be empathetic. So you want to seek to understand before you seek to be understood. That's an important factor, that you allow yourself. You want to really create that space to understand what the person is saying. And you try to be non-judgmental. I mean, we all have our biases, and someone may say something and immediately it might bring up something of our past history. We go, ooh, it's okay to bring it up, but don't let it interfere with your aspect of listening. Mm-hmm. And to give that individual, again, your undivided attention, that they really know that you're really interested, that you're there for them. And oftentimes, we're very uncomfortable with silence. And so there might be in the conversation that you have that the person or client may pause, and we want to fill in the gap instead of just allowing ourselves to listen. And so this is what the U.S. State Department uses to teach diplomats in how to listen. I remember I was taking this course in pastoral counseling, and the professor said, there's 3 rules to listening. The first rule is to listen. The second rule is to listen. And then she said, can anyone guess what the third rule is?
I would guess it's to listen.
And it's to listen, correct. Because when you listen, you look at the whole aspect of the person, their body language, their face, what's happening, how they're responding to your questions, or how they have a sense that you're listening to their story. And so that's an important aspect. And then the Harvard School for Management has an assessment that I could send you or give you the link for the listeners. Am I an active listener? Mm-hmm. And so it's a way of judging yourself. When someone is talking, do I listen? And it has all these about 13 different aspects of listening. And you can do an evaluation, and you can say, well, really, I need to work on X, Y, and Z because I'm not really listening. So those aspects are extremely important when you try to listen to the story. Now, Eric Gundry says that when you have a sense of being heard, you can make choices. And so we may want to reflect on, gee, was there an experience I had when I really felt that person listened to me, that I was heard? And it might be good for the listeners to just pause and reflect. Yeah, I remember X, Y, and Z. I remember my spouse really understanding and listening to me. Or I have a sense of, growing up, my father and I just had this wonderful conversation, and he really heard what I aspired to do when I grow up. So they're powerful experiences. And if we can allow ourselves to get into that arena, then we can help ourselves be a great listener and also have a sense that we're communicating and not giving advice.
Right. Now, how does this listening, is this, and I don't think this is probably necessarily specific to caregivers per se, but how is this listening more important for caregivers than it would be for maybe another profession or role?
Well, we're trying to pick up clues, whether or not we're a homemaker or a doctor, nurse, etc. If we don't allow ourselves to be present, we're missing clues. Mm-hmm. Now, those clues can be something that's happening inside myself. I may have an experience of when I'm working with that person, that client, they remind me of something that I really don't want to look at. And so I often said, and I think I said it in the first episode, that the people we're called to serve become the healers for us, because they bring up both our joys and strengths as a caregiver, but also they bring up areas of growth that we need to look at. And oftentimes, when that comes up, we get very frightened and we don't look at it. So, if the homemaker is not recognizing that when the person may not be able to talk, but they're grimacing, well, does that tell them that they're in pain? And so can they listen to that body language and be able to hear? Or the person may have a speech impediment and it's extremely difficult and we get very impatient. I remember taking care this person that had a brain injury from an automobile accident. He was a big 300-pound guy, and I would have to help him get his, get out of bed, wash him and all this stuff. And he would scream and yell, and I would have to pause, because my first reaction was, I want to get away from this. But, to listen to his frustration that he couldn't express himself as clearly as someone without this impediment. Sure. And so that's an important factor for a caregiver.
Well, and I think that leads to this question: what sustains you in your acts of caregiving? Do you have examples that you could give? Because, one of the things I think that is sometimes misunderstood, or, there's a misconception of, is that caregiving is sometimes an easy role and an easy obligation, where, like your example with somebody with a TBI, a traumatic brain injury, or somebody with advanced dementia, there could be, and unintentionally too, let's add that, it's not by choice, but sometimes there's verbal abuse and even at times physical abuse from these individuals because of their cognitive deficit. What sustains you as a caregiver when you're going through situations or scenarios like that with patients or clients?
I believe, well, again, from my own experience, but I believe most caregivers have those moments when they're very grateful in being a caregiver. They're those wow moments. And I remember visiting a person who was dying from AIDS. And he said to me, "You don't know how long I've waited for someone like you to come and talk with me."
Wow.
Well, what do you do with that?
Right.
And so as we continue to reflect on what his real needs were, his real needs were that his family would know that he was in the hospital. And what happened was his father came to visit, and he asked to see me. And he said, "Is my son in the hospital?" Well, his son didn't give me permission to say whether or not he was in the hospital. And so I said, I will look and I'll get back to you. And I went up to talk to the patient again, and I said, your father wants to see you. And he said, "Oh, would you help me? Would you be there with me?" Again, that sense of, will I walk in his shoes? Will I support him in this? And I said, yes. So I called the father back, and he came with his wife and 2 sons. There were 5 sons in the family. He was one of them. And they come into my office and we're talking. And I said, "Yes, he's here, and he really wants to see you." And I said, "Do you know what he has? Do you know why he's here?" And there was silence. He had already told his brothers, but his brothers never told the parents. And they said no. And I said, "He's dying from pneumonia, which is a complication of AIDS." And his mother just said, "I knew that's what he had."
Wow.
And the father said, "What can we do?" And this still brings emotion in me when I say it. I said, "All he needs is for you to love him." Tears all over the place.
I can imagine.
And the nurses, I came up with the family. The nurses knew what was going on. And I knocked on the door, and I said, your parents are here." And they walked in and they just grabbed him and hugged him. It was a big Italian family. And till he died, he went to hospice, and till he died, they were there every day supporting him. that intervention still gives me goosebumps.
Sure.
So that's what sustains me in knowing that I was instrumental in my caregiving that became a sacred intervention. And so when there's times I feel, oh, can I deal with this? It's a reminder for me to take a deep breath and remind myself, what can I learn from this?
Yeah.
And even though it's difficult, I'm able to step back, which is a skill you have to learn, instead of, as you said, there's a lot of verbal and physical abuse by caregivers towards clients because they're impatient. And so that's what sustains me. And also knowing that the work I do is sacred. And we'll talk about that in the next episode, that caregiving is a spiritual practice.
Absolutely. Well, and then, we touched on this briefly in the previous episode where, you named the book The Soul of Caregiving, because soul really signifies a different level of a person. It's kind of the core of the person. Can you further explore what your understanding or what you would consider soul, and how it's multifaceted, like almost like a gem radiating different hues?
When I talked to my consultant about what I should name the book, he said, Edward, you're talking about soul. Now, when we think of soul, immediately, some of us have a religious focus, and some of us don't. It's like some of us will think, well, Casper the Friendly Ghost. Soul, to me, is multifaceted. So we can talk about soul music. We can hear about what is it about the music that takes us deeper and deeper into ourselves. And what about a soulmate? Who is that person that really understands who I am, the I of who I am? And again, in the Hebrew scriptures, when Moses says, who are you? God says, I am who I am. And Houston Smith says, the more we understand our own I amness, the more we understand a God who says, I am who I am. And so that's a factor. We can think of soul food. I come from a Slovak tradition, and at Christmas we have these special meals, and it's soulful because it's more than who I am. It's a tradition of many generations. And there's a saying that heaven is an Italian kitchen. So it brings a smile to you, because what is that favorite food that we enjoy that is more than just eating that food? Sometimes we want to duplicate a recipe we learned from our parents, and it never comes out right. And it never comes out right because the memory was with our parents.
Absolutely, yeah.
And so we can think of that, and so we can say, well, I'm creating a new memory. So, there's soulmate, there's soul food, there's soul music. And I like to understand soul as that inner aspect of our being where we're able to really understand who we are, that it's a meeting of my humanness with the sacred. If we're made in the image and likeness of God, according to the Hebrew scriptures, well, what is it about who I am is a sense of understanding who God is. Mm-hmm. And so that helps me when I'm in a situation where it's overwhelming, again, to pause and to say, what are my particular values? What are the values that I have? Well, caregivers are known for their compassion and their dedication, their generosity and their helpfulness and their nurturance. And all of that is important. So if I do that for others, how do those same strengths help me take care of myself? I like what Thomas More talks about. He wrote the book, Soul Care, I think it is. And he talks about different characteristics of soul. Well, the first is it has to do with depth. So as soon as we hear the word soul, it means that we're going deeper. And I think I said the other day that James Hillman says, you know, psychology is the religion of the psyche, but when you speak of soul, you go deeper.
Right.
There's something depth about it. And it talks about our values. What are the values we have as a person? And those values are articulated in our behaviors. We may learn from our parents certain values, but the difference is we express them differently. Every generation expresses them differently. Right. And so that's an aspect that we understand our values. Another aspect that I really like is he talks about soul has heart. Now you can remember the Tin Man in The Wizard of Oz. I'm an empty I'm an empty figure without heart. I have to have heart. And so there's something about heart that brings us to a deeper understanding of that particular mystery. And so there's another aspect that we have, which is called personal substance. That it means that we are in a relationship. So soul brings us to a relationship. Maybe what we lack often is we lose insight into the relationship we have with ourselves. And so there's that personal relatedness. And relatedness means relationship. So that's another aspect. Soul brings us into a relationship. And I'll talk about that more with hospitality. So we have depth and values and relatedness, heart, and personal substance. They're all characteristics of what soul is. So you can see we're putting together, it's called phenomenologically looking at soul, which means like the hues of a gem. There's many ways of looking at it, which helps us understand its deeper value, which has to do with that inner place in me where I know who I am.
Absolutely. And, you know, you've touched on hospitality a couple of times, and you mentioned in your book that you consider there to be 3 different attitudes of hospitality. You mentioned hospitality, but could you elaborate more on what you think those 3 characteristics are, or the different attitudes are?
Of course. When I started my research, I mean, it's very common in ancient writings that to be hospitable is to be open to the guest. And so even if we're a homemaker, a spouse or a professional, every day is different. So are we open to that guest, to that person we're caring for? That's the first attitude. So you can think of being called first responders being called to a situation, or I wake up and I'm called to go to work, or I'm at home and I'm taking care of my spouse or our child, or I'm taking care of my adult parents. Every day is different. And so that's the normal aspect that we do almost unconsciously. We're called to serve. The second attitude, and I use the word attitude because it's a frame of mind, or I would say it's a frame of soul. And so the second has to do with what's the relationship we have with that particular person. So you can think of, the classical theme of a firefighter holding a young child whom he saves from the fire. Well, you can see him holding that child, and you could see that there's a sense of relationship. Or if the parents come, that he's open to recognize that there's something relational in that work, what he just did. But the third attitude, which I didn't understand fully until I was doing research on the book, is how does my response to the client and the relationship I build, how does that affect me? So what's the story I have? And that's what most of us caregivers don't spend time with. So going back to the example I gave of that father coming to the hospital looking for his son, if I just dismissed it and went to the next thing, I wouldn't have learned what I learned. And so what sustains us is the reflection we do in what we've learned. This experience taught me something, and that's invaluable. As this incident that I'm talking to you now happened maybe 20 years ago, but it still affects me.
Yeah.
And so those are the simple attitudes, and it's not like that. There's one and then there's two and it's three. It's more like a spring that has many ripples, and so, or the other way, that there's the first ripple that leads to the second ripple that leads to the third ripple or circle. And when we allow ourselves to go into that place, then we find ourselves being sustained and helping us be a better caregiver.
What do you think it is about developing an interior attitude of hospitality is so important for caregivers?
I believe that it helps the caregiver appreciate, support, reclaim, who they are as a caregiver.
Mm-hmm.
That this attitude is really what sustains them. It has sustained me. I mean, here I am, I would say in the last third of my life, being animated to want to reach out to caregivers who are experiencing compassion fatigue.
Yeah.
It's something that animates me instead of sitting on a couch or going fishing every day.
Right.
There's something in me that wants to reach out, and I believe it's part of God's Spirit saying this is what you're called to do. And so that third attitude nurtures us,
right,
in a way that helps us cope and deal and prevent compassion fatigue and burnout.
Is this, and I'm assuming I know the answer to this, but I'm going to go somewhere with it. Culturally, it can depend on your culture how easily or how difficult it is for you to develop this mindset or this attitude of having the soul for caregiving, being open to sharing your story, being a better listener, and I think your overall approach to caring for another person, albeit professionally or personally. I know we've witnessed this with families that we have helped in many different instances. Depending on the culture, the approach that the family takes and that our company takes varies. You know, some cultures from the Middle East or the Far East, you know, they will circle the wagons, so to speak, to support that parent or that grandparent. But then when you look to your more westernized cultures, it's not the same. So when you're meeting with caregivers or you're approached by families, how do you approach? Is it a different approach depending on the culture or their background, or is it the same for everyone regardless?
I would say it's the same in the sense that you want to be present in a way that meets them. Mm-hmm. But the how-to is different. So an example is I was the administrator on call, and I was called to this situation. The nurse supervisor called me and said that this Buddhist patient was dying. He was in intensive care. He was made a DNR, and the family wants to bring in a tuxedo. And it's like, duh, what do you do with that?
Right.
And so I said, did you ask them why? Oh, I didn't think, oh, no. Why do you want to bring a tuxedo? And first of all, the nurse said, well, that's easy to do. We could, put the pens on and so he'll be okay. So they asked the family, and the family said, we want him looking great when he meets his ancestors. So again, that sense of listening, and the culture was, that they believed that he would meet his ancestors. Now, that was a Buddhist tradition. You can talk about the Christian tradition also that believes that we will meet God, right, but also our ancestors. There was another time when I was called, and I may have said this the other day. Sometimes I get confused in which story I tell. Well, I just get generally confused, so we can just leave it at that.
Okay.
It's called Sometimers. I don't know if you've heard of that. Sometimes I remember and sometimes I don't. There you go. I was called that this Islamic family wanted to bring their mother home, who had just died. And the nurse said, gee, I don't know if we can do that. They may get arrested. And so I said, again, here's the question. Mm-hmm. Have you asked them why they want to do it?
Right.
And they said, we want to do the ritual washing. And she said, oh, we could do that. We'll move the patient in this empty room. The family could go in there, do the ritual washing. And remember when in the Christian accounting of Jesus, they were going in the next day to bring perfumes and care for Jesus who had just died. So that was again a very simple intervention. The aim was to meet the needs of the family, so that's why they're always the same. On the other hand, the how-to was different. To understand the Islamic tradition, where the women would go in, and some of the men also, but mainly the women, would go in and wash the body and anoint the body, doing that ritual washing within the Islamic tradition. So those are just two particular stories about different culture. Now, in the Western culture, it's difficult at times to get the family to participate. Some do and some don't. And again, it brings up whether or not they have a healthy relationship with the person who's dying or an unhealthy relationship. So it's not like everyone comes together. It's like, oh, we have to find people that want to come together.
Right.
And so that's another aspect. The Mediterranean cultures, you could talk about the Italians and Hebrews and Greeks. The family is everything. And so oftentimes you have to, I remember one time everyone wanted to see the doctor. And I said, the doctor isn't going to see everyone. Can you choose one person that will represent you? Well, that was a battle in itself, but they finally did that. And so the doctor was able to communicate with that one person back and forth. And anyway, there are those different cultures. And I talk about, I think it's in the book, but I'm not sure, but I talk about the fact that we're in our culture, the American culture, it's hard for us to be vulnerable and to ask for help. In the Mediterranean cultures or the Eastern cultures, it's difficult for the individual to break out of the common circle. So there's a tension in both of them to try to seek self-care, but it's different.
Right. Yeah, they battling opposite ends of the spectrum.
Exactly.
Right.
Yes, exactly.
So as you were exploring hospitality, what's been your experience as being the host of listening to the story of the one you've been serving, and how you've recognized those interior movements in your own soul because of those experiences? How has that progressed and changed over time for you?
I think it's matured because I recognize that there was, the insights come spontaneously. It's not like I'm racking my brain, they just come.
Sure.
And what I've learned was to spend time with them. There was another person I was dealing with that, again, I used to work in this AIDS unit, so that's why the second person, he was abandoned by his family. They wouldn't have anything to do with him. But his partner's family adopted him. And I remember I was called in to see him. And he said, "Ed, what do you think of suicide?" And I'm going, red flag, red flag, red flags. Do I panic or do I listen?
Now, was this your role as the nurse or as the chaplain at that time?
As the chaplain. And I allowed myself just to pause and say, and ask the question, why are you contemplating suicide? I could have panicked and said, oh my God, I got to call the supervisor, I got to call the psychiatrist, this is a crisis. Or we can diffuse it and get a sense of what's going on. He said, I don't want to be a burden. I don't want to be a burden to them. And how many clients say that? I don't want to be a burden to my family.
Right.
Okay. And so he said, I don't want to be a burden. And I continued to talk with him, and I said, your adopted family wants to see you. And he said, they want to see me? Here I am, dying, they want to see me? And I said, yeah, they want to see you. Now, his background was Christian, and there's a passage, when I'm lifted up, all people will come to me. That's a reference to Jesus. Well, here is another crucified person, and this person is saying, when I'm lifted up, I'll draw people. I said, so your adopted family is drawn to you. And he goes, oh. so you mean it's better to be there for them? And I said, yes. And they came in and they supported him until he died. And the question was how I listened and how that became a sacred moment for me. And I remember leaving that room and almost going outside and wanting to prostrate myself on the floor saying, thank you. Thank you. The moment was so powerful. I mean, even now I'm talking about it. It was so powerful, it moved my entire being. So can we trust those movements? I mean, that's number one. Can we trust the fact that that's how God's Spirit works in us? And it supports us in our work, in our mission or acts or ministry of caregiving. It supports us, nourishes us, feeds us. And, you know, I could talk, what do they say? Talk till God's kingdom come about all these experiences. But I've learned to listen to those experiences.
Right.
Instead of just dismissing them.
Well, and I think this is a great way to sum all of this up, is it goes back to the listening, you know, and like you said, listening with both ears, not just one, because I think, you know, on both sides, I think it's important for caregivers to be heard, but I think it's as important for those that they're serving to be heard, because, you know, for elderly, for those with disabilities, those with terminal illness, oftentimes they can and they do feel like they're a burden on their loved ones and their families. And, you know, they see the suffering that their families and loved ones are going through, and they almost feel like it may be better if they were no longer here for the sacrifice of their family's benefit. But just taking that extra time to let them talk it out and to maybe let them re-examine their perspective with your example can make all the difference in the world. So that's why it's so important that caregivers, medical staff, anybody in direct contact to serving others needs to take that extra time to sit and listen intently, not just passively, but intently on what that person's wanting to share. Because for all you know, if you hadn't gone in that room that day, that man may not have had the opportunity to share that with anyone else, and it may have been too late, you know? And so having the wherewithal to, and the patience to just listen to what others have to say, it could be meaningless or it could be very powerful, like your experience.
That has been my experience. And James Hillman talks about there's a sense of faithless science and unscientific faith. And what he's talking about is the difference between the left brain, which is the practical, the logos, and the right brain, which is the creative, and the mythos, the mystical. And they both work together. It's not like I'm, you know, left brain this time and right brain that time. They both work together. And when we allow that mythos to speak to us in the practicality of what we're doing. So it's not like we're on some cloud. It's the fact that in the situation that we're doing, we can experience the sacred. I talk about John of God. He was similar to Mother Teresa. And there's an example when he was washing the feet of one of the people in his hospice. He had an experience of Jesus. And so, you know, all the art forms, they have all this art forms about how that is. But the reality is, as happened to me, and I'm sure it's happened to you and many caregivers, in the midst of doing the ordinary, we experience the mystical. It's not separate. It just happens because of our attitude in listening. And again, I'll talk about that more in the next episode.
Absolutely. Well, Dr. Smink, I appreciate your time today for part 2 of our series on the soul of caregiving. I'm looking forward to part 3. And I hope you have a great afternoon and look forward to seeing you next time.
Thank you so much again.
Thank you. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at our website at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to thank Dr. Edward Smink again for joining us for part 2 of our series on the Soul of Caregiving. We look forward to seeing you next time here at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.